All right, hi you guys, it's Dr. Green. Sorry for the delay in getting these lectures up. It's been a very kind of a long day traveling back, but hopefully the goal is that you guys will be able to kind of review these lectures as you study for the final. We'll do a brief review of this in class tomorrow, but I want to at least get this up for you guys. That way you at least have this. Okay, so we'll do this for the endocrine system, and then we will also do this for the nervous system and special senses. And then we'll do the musculoskeletal system in class together. So as a whole. Okay, so the endocrine system. Okay, so ultimately, when we talk about the endocrine system, we're talking about essentially, a system that's made up of all of the endocrine cells in the body. And so essentially endocrine cells secrete chemicals in the tissue, right? And the main type of chemical messenger that we're going to talk about and the most time on is hormones, right? So hormones are different in the sense that hormones are generally secreted directly into the bloodstream and have an effect on tissues either near the site of secretion or far from the site of secretion, right? So an example of this is prostaglandins actually released from injured tissue during a musculoskeletal injury, like maybe an ankle sprain or like a knee injury, right? So prostaglandins are one example of hormones. They can be released at the site of injury, right? So obviously, those cells or tissues or organs that those hormones act on are referred to as target tissues. And obviously that the main job of the endocrine system is to maintain homeostasis. So here's an example of the endocrine system actually maintaining homeostatic function. So we use the example obviously of blood glucose control, right, as one example of maintenance of homeostasis. So for example, we can see by the number 1 here, obviously if we eat something sweet like a piece of cake or something, right? Obviously, blood glucose starts to rise. As that happens, obviously, the beta cells in the pancreas and the islets of Langerhans actually secrete insulin into the bloodstream. Once that happens, that glucose in the bloodstream is actually transported into the cell, where it is uses obviously as energy to make ATP. And then the blood glucose level obviously goes down. Conversely, clearly when blood glucose goes down, glucagon is released from the pancreas, breaks down glycogen, and then blood glucose levels go up. Okay. What are some of the organs we're going to talk about, particularly in regards to the endocrine system, right? So this really comprises everything and really kind of an axis, and we typically we do refer to this clinically as an axis, right? So generally speaking, we're gonna start really at the hypothalamus, right? And there's a very important anatomical and physiological relationship that we're going to discuss here in a second between the hypothalamus and the pituitary gland, right? So the hypothalamus obviously is a producer of hormones. Obviously, the pineal gland produces melatonin, right? We have the thyroid, parathyroid hormones or parathyroid glands, which kind of help regulate not only obviously calcium production, as well. So that's obviously extremely important for bone health and also kidney health. Okay, the adrenal glands, pancreas, ovaries, testicles, so on and so forth, right? And then obviously we have some issues that we don't really think about so much. The hypothalamus, kind of as we thought, there's a direct relationship between the hypothalamus and the pituitary. Obviously, with the heart, there actually are glands directly over the atrium, the left and right atrium, that produce natriuretic peptide, or ANP, right? Which actually help kind of regulate blood pressure production, particularly in the event of hemorrhage or rapidly declining blood pressure, right? Kidneys, the GI tract, the placenta, which produces HCG, in a pregnant woman. And then we have obviously the endocrine glands, and we can see that they typically function by targeting an effector, either a muscle gland or nerve, either near or farther from the site of secretion. Okay. Yeah. We talked about the hypothalamus. Obviously, the hypothalamus releases an inhibitory or a hypothalamic releasing hormone, which acts on the pituitary gland, right? So it's really important, though, to point out, the differences, though, between the hormones produced by the anterior pit as opposed to the posterior pit. So obviously, we have FSH, or follicle stimulating hormone, or luteinizing hormone, that are produced in the. We have thyroid stimulating hormone, right? Which the target tissue obviously is the thyroid itself, right? We have adrenocorticotropic hormone and growth hormone, and then prolactin, right? The posterior pit or posterior pituitary produces fewer hormones, specifically oxytocin and ADH, right? The pineal gland, as we already mentioned, produces melatonin. The thyroid produces thyroxine, which is important in the storage of iodine. And then clearly, the parathyroid glands are actually four little thyroid that actually help us regulate calcium levels, right? So then our adrenal glands, obviously, aldosterone, which actually has a direct effect on blood glucose levels and metabolism, right? It's extremely important. Glucocorticoids, such as cortisol, stress hormone, right? Then we have DHEA, so sex hormones, and then epinephrine and norepinephrine, which are actually produced in the medulla of the adrenal gland. So clearly, as we can see, right, all of these hormones actually have there's actually a direct relationship between the clearly, in the hypothalamic inhibiting or producing hormone, obviously, and the effect on the pituitary and the target tissues. But one thing that we need to discuss is exactly how that relationship actually works, not just but also anatomically, right? So there's actually within the hypothalamus, obviously, the direct production of ADH and oxytocin. But if thyroid, obviously, releasing hormone is released. That's actually going to obviously, aid in the production, obviously, of hormones that actually transport those chemical messages into the pituitary. But how exactly does that happen anatomically? Right, that actually happens via what we call the hypothalamic portal system, right? And or the hypophysis, right? So we can actually see that those hormones are being released, obviously, into the portal system, and then into the capillary bed within the anterior and posterior pituitary, and that is actually how they make their way into the pituitary. So obviously, regulation of the anterior lobe of the pituitary, occurs, through a negative feedback loop through the target effector, right? And so then obviously the hypophyseal portal system delivers that ADH or that oxytocin to the posterior lobe of the pituitary as well. So all of that actually occurs via the capillary bed of the pituitary. All right. What about the thyroid, though? So obviously the thyroid, as we already talked about, is obviously important in the production, right, of thyroxine. And so there's actually kind of a newer school of thoughts. We typically used to think of thyroid disease as actually being or hypothyroid. But now actually we're beginning to really think of altered thyroxine hormone levels or altered thyroid function really as a disease state of thyrotoxicosis, right? And not necessarily essentially applying a diagnostic label, excuse me, of hyper or hypothyroidism, at least right away, right? And we can see, obviously, anatomically, the relationship of the parathyroid glands to the thyroid gland here in this picture. Okay, almost there. And so obviously we know too, with the endocrine system, clearly, as we talked about, stress hormones are actually produced in the adrenal glands atop the kidneys. And so clearly these are obviously very important in fight or flight type situations. Okay. And so we can obviously see that, in the event of increased cortisol production and increased epinephrine and epinephrine production, that flight or fight response will be heightened. And this is obviously due to increased input from the sympathetic nervous system. Okay, let's get into some word roots, guys. So we have adeno, right, which means gland, obviously adrenal or adrenalo, okay, which is referring to the adrenal glands, cortico, referring to the cortex, and endocrino, okay, parathyro, which referring to the parathyroid glands, okay, thyroid or thyro. So often a condition that we see with thyrotoxicosis is a condition called acromegaly. So often what we'll see, and we can see this combining form here, so acro and megaly, which means an enlargement of the extremities. Typically, this is going to manifest itself in an enlargement of the facial structures in the jaw, excuse me, as well. So very often we will see acromegaly actually manifest itself in a kind of an enlarged appearance of the jaw and facial bones. So we have calcio, the combining form for calcium. Okay, we have dipso, which is the combining form for thirst. Often people who have diabetes will, a presenting symptom for that may be polydipsia. So a sensation of feeling thirsty frequently or constantly, right? And then clearly, obviously, there are different, obviously the prefix for potassium and sodium, so calo for potassium, and then natro for sodium. Obviously, there are situations in which we can, sometimes have patients with hyponatremia or hypokalemia, okay? And then we have a suffix here that is paired with some of these terms, drome, which means running, okay? All right, so some other things to obviously be aware of as far as terms: acidosis, which is a condition of, there being an excessive amount of acid, particularly in the bloodstream, right? Acromegaly, we talked about that already. Okay, Addison's disease, cretinism, Cushing's syndrome, diabetes, gigantism, okay, goiter, which is actually a condition caused by enlargement of the thyroid due to obviously kind of enlargement of the thyroid cells, which actually kind of makes them, unable to secrete thyroxine due to being kind of engorged. Oftentimes those goiters typically are watched over time unless they become an obstruction to breathing, at which point they will be addressed potentially surgically. Okay, Graves' disease is another endocrine disorder. Okay, ketosis. This is often kind of an end stage symptom of hyperglycemia, particularly in those that have diabetes. I've seen this in patients before, and it can be it can be extremely dangerous. We've diagnosed in patients type 1 diabetes this way. We've had, a patient that I had previously that was not aware that he was diabetic, went out and went into diabetic ketoacidosis during football practice. Over the course of a couple of days, developed this condition, ended up in the ICU, thankfully survived, but very, very important to be able to kind of recognize ketosis when it occurs, right? So tetany, we know a lot about this. This is actually a condition essentially of prolonged muscle spasm after infection, right? And this often happens after, a cut or a laceration or a puncture wound from a dirty or contaminated object. Okay. So very quick lecture over the endocrine system. We'll review this more tomorrow in class, but I at least wanted to put this out there for you guys. Okay, so thank you so much.